So I just wanted to let you know, as part of my work with the Justice for Girls Coalition, we took a crack at trying to figure out what are the most common principles people are saying should be involved when you're talking about gender-responsive practice. And these are the principles that the coalition I'm involved with developed, and they're very similar to a number of different principles that have been adopted by different states or different researchers in this area. Some of the kind of big people include Leslie Akoga in '98. She did a huge kind of review and paper on this. Laura Prescott from the Gaines Center did an early paper on gender-responsive principles. There's kind of coalitions across states that have tried to come up with these. So ours include being culturally responsive, and that's really about making sure you are paying attention to that within group difference, because the worst thing I think that we could do is create a stereotype that we feel like girls have to fit into. So the first thing is being really aware of the need for individualization and gender, within class difference. Building from the relational theory, recognizing healthy female development develops on these mutual relationships, and that's a little bit of an article of faith. I mean, I come probably from more of that quantitative. I want to see that that's true, but it seems to be working. So anecdotally, we'll go on that. Addressing safety, using a skills-based and strength-based approach, and serving girls holistically. So looking at all the different areas of need and support in her life. And so a lot of these you could just cut and paste into what you would consider best practice for boys, for sure. I think probably the only one that's like significantly different would be the relational theory, which even then you could play with that. Boys obviously have relationships that are important to them. So, but it's a good way to get started. I know there's an idea out there that girls might be a little bit more sympathetic of a population. So if you can start with good work in there, it might branch out, and you might be able to start making greater reforms for boys too.
That's what we do with mental health stuff, yeah. Right? I mean, you start there. The mental health population is a lot more sympathetic than sort of this aggressive male population.
Yeah,
makes some inroads.
Yeah. But there's also barriers to starting with girls, which is that it's really hard to get sustainable funding, and you do get that pushback. Like, it's going to be differential treatment, and you can't treat people differently. So, there's some political barriers too for gender-responsive practice. So here I have to give credit to Ann Munoz, who's one of the co-founders of Powerful Voices, which is an advocacy and kind of treatment group based out of King County. And she's also our project director for the coalition. And she went and did a bunch of site visits. She went to 4 different states around the country, and also we administered a survey to 12 states around what they're doing to translate these gender-responsive principles into practice. And so these are some of the ideas that are some of the things people are doing. So having all-girl courts. So you have a female judge, you may even have female attorneys, and the focus really is on diversion and addressing mental health and trauma issues. 4 counties in California are doing girls' courts, and the idea is to keep violations low. So you don't want to mandate treatment participation. You want to keep at a minimum the number of hooks you could use to get the girl more deeply system involved, and then using holistic and strength-based assessments. So, any reactions to that?
How do the girls like it in those courts?
It's a good question. I don't know that we have data on how much they like it. I'd have to look for it. I didn't find it easily.
Is there any outcome data on it?
Not on girls' courts that I'm aware of. They're just so brand new, and that's a liability of this whole area. Is there's very little outcome data at all on any of this yet.
How were they? Do you know how they were established under what funding? Did they get grant money?
I'm not specifically sure about California, and I could look up the counties. I know Santa Clara is doing it. I could look up the counties for sure. I think I know with some of the stuff they're diverting residential treatment dollars, and they're putting it towards diversion, plus maybe some federal dollars come in and kick in. But they actually make a decision to take it out of residential and put it on the front end.
I'm sorry. There's an interest, so you asked for reactions. There's an interesting sort of gut reaction that maybe I don't like very much, but and I think the same thing about drug courts, mental health courts, and everything else is that we expect equal treatment under the law for people, And so, we know also that races experience the court system very differently. They have very different predictors for what gets them into it. They're different. And so, but we want to have like a white court, And so when we talk about like gender courts, it gets to be like kind of a little uncomfortable, a little bit even more uncomfortable with like a mental health court or a drug court.
Yeah.
You're right, because it's just based on a demographic.
Yeah.
Not a need. Yeah.
But there's something about the juvenile court system that, it's the law, but there's also rehabilitation too. So I mean, that's, the idea of being equal under the law is one thing, and it's very important, and it's hard to get around that. But with the focus on rehabilitation, focusing on individual needs, however you break them down, whether it be mental health court, drug courts, girl court, sex offender court. I mean, it's you can hand out services a little bit more in a directed fashion.
There has been some studies that there can be bias with male judges and female respondents, but I think you would find the same thing with ethnicity. So, it begs the question.
My thought was with that too is like you just can't assume that females are going to somehow be more compassionate or, towards other females because we tend to be pretty mean to each other a lot of the time too.
Yeah. So like, what are those biases? I mean, are those biases necessarily going to be protective or?
Right.
It seems like a really ham-handed response in some respects, because I'd like to know, is there any research on what girls actually do well in the current, and maybe we need to speak to finding those girls who are at risk for doing poorly, and then directly provide them the skills to actually manage the system effectively. Rather than sort of generate a bifurcated system.
Yeah, because another thing it perpetuates is this idea that potentially this idea that, as a 15-year-old girl, I'm going to learn that I should relate better to girls. Maybe I should hang out more with girls, maybe I should
Well,
I don't know.
That's another argument, too, for correctional staff, because some would argue that you should have all correctional staff, but then others would say, well, no, actually having good, healthy male role models is actually really important for girls, too. So maybe nobody would contest that you should have, when we're talking about corrections, female staff doing searches and stuff like that. But then not just saying that it should be all female. So I think there's good arguments on this side. This is just what some people are doing.
Well, there's also the thing that most specialty courts also just have this kind of increased resource that makes it difficult to disentangle whether it's the mechanisms of change that are specific to the population that court is treating, or if it's just that you're getting lower caseloads, greater judicial interaction.
All that better practice.
Gateways to treatment that are making it more accessible, people who are encouraging you to stay in it. I mean, that's essentially what the family treatment court at the county does, is you get lower caseloads, social workers, and you're getting put into you're going to court more often and so forth, and it may have very little to do with the specific modalities of it.
And are lower caseloads and going to court more often associated with better outcomes?
Yes. That is not. We've just done some recent analyses.
Because I was wondering if it could be a similar effect to thinking about some of the studies of Mark Chafin and PCIT, and PCIT sort of bundled with other services, and it was actually less effective than PCIT alone, and is more better, and in what ways can more be better or worse?
Kaminsky and Valley.
Interesting. And the supervision level is supposed to be like probation. Again, doing the all-girl caseloads for probation officers, so that and one of the reasons I think they do this is because then the POs will actually pull together therapeutic groups with their caseloads. So in addition to just doing supervision individually, they'll pull together the groups all together. Having mandatory training in female development, girls-only groups. And I'll talk a little bit about what we're studying in Washington State. I think what's not as well understood is what probation officers would actually be doing with the girls in those groups, and how therapeutic that would be, and that they're not necessarily trained in group therapy, and kind of what's their model for that. And then also just being sensitive to holding groups in geographically diverse areas and helping youth with transportation and all of that. So get some of those comments.
Is there any research, how Tom DeShawn did all that research on kind of the confusion effect of putting groups of antisocial boys together and everything. Does that translate over to girls too? Has there been any research in that area?
It's not something I've looked at specifically for girls. Yeah, I'm not sure. I mean, I think if you were going to use that, you would just say, don't mix them, try to keep them separate, but
don't have a group at all.
Yeah, or just don't do
right.
groups.
I mean, that's true.
Well, so we'll talk a little bit about that, about the girls groups, and when I'm trying to look at that and getting your thoughts would be great. And then in detention, some of the practices mentioned, including, again, doing shelter care or the girl-only observation assessment centers versus detention for girls who need secure care. Having policies in place to reduce physical responses, using female staff for the sensitive interventions like searches, doing intakes in semi-private or private areas, so girls are more likely to talk about past abuse or trauma or whatever. Again, doing the staff training, allowing contact with families, and having on-site mental health specialists, which is not as frequent as you would want. And then in corrections, similar principles to detention, a little bit differences because they're there longer, trying to get youth as close to home as possible. Allowing girls a little more autonomy around what they wear and do. And that's another thing in terms of treatment planning. When girls are involved in treatment planning, being really mindful to make sure that they're setting those goals. And I think stuff that Washington State, again, is probably ahead of in comparison to some other places around good practice. And giving girls opportunity to talk about stuff. So interesting, you mentioned like the log notes of the mom calling the sheriff a lot, and I was just looking at detention notes over on Benton Franklin County the other day, and they were by day, and so I'm looking at over these days, and I keep seeing this note of like this one girl who is, I didn't know who she was, but this one girl who was like saying she was sick and wanted to talk to somebody, and then like, oh, her headache went away, but now she has and I think what detention officers will report is that the girls eat up a lot more of their time, and they're a lot more needy. And a lot of this could potentially be driven by, it's just not an environment where like girls are not kind of getting that need met to like interact with people, which might be it might be a stronger need, and that might really be where you're kind of seeing that gender difference emerging a little bit in terms of educating line staff around, girls are kind of reacting to this environment. It's just not a great environment for them. They more opportunity for interaction and talking to people, and could probably help some of that.
In this age group, more likely to express distress in psychosomatic terms? Or?
I'm not.
You haven't come across that.
I don't know that much. I think Sasha might be able to. Do you see that?
Well, I think that for the most part, the girls are pretty free about saying things in counseling. It's not. I think for the boys, sometimes there's more stigma about actually wanting to see mental health care, so they might emphasize a little bit.
I mean, it sounds like in this detention setting, Ben, frankly, I'm not sure what the availability of counseling and talking to other people are, and then it's like a more socially acceptable way of asking for help. With some other complaints.
Right. Yeah.
But in general, adolescent girls have higher rates of depression and psychosomatic symptoms can be able to express depression in adolescents. So, outside of detention, you might see more of that.
Okay. And also, again, the ethnicity, other culture issues is just one example. When we're talking about girls, we have to be really careful. We're not we're not just talking about white girls, which is, might be easy to start doing in terms of people who are kind of driving a lot of this reform. They may not be paying attention to a lot of those nuances. So this was one program that was developed specifically for African American girls, and it wasn't found to really work very well for white or Asian girls. Counselors were African American. It was a lot more attuned to African American culture. So just as programs get developed based maybe more on a sense of what white girls need, you can find that same finding. So just being really kind of careful and cautious around that.
Is the research that you're talking, or the theory that you were talking about earlier, culturally bound?
The relational theory of development? Yeah, that's a good point, because my guess, but it's just a guess, I'd have to go back and look. I mean, I'm wondering if, Carol Gilligan did most of her interviews with white women. It could be. And it's, so there might be different orientations that interact with culture, too.
In this program, are you talking about matching based on ethnicity, or matching counselors based on ethnicity, or?
I think most of the counselors were African American in the program, which you switch it, and in other programs, most of the counselors are going to be white.
Right.
Yeah.
Just looking at the effects that.
Yeah, exactly. Okay, so these are just some practice recommendations based on the literature, but I think we'll just